This week's class, When Your Health Matters, a class designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center, located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. If you want to come see me, would love the opportunity to meet you, to discuss with you what your health concerns are. But I realize that people are a little apprehensive about coming to the office due to COVID-19, etc. That's totally your perspective. The reason why we're doing these weekly healthcare classes via video now is because of COVID and people's fear of interacting with strangers, certainly possibly healthcare offices where COVID may be lurking. We don't have any of those problems here. But anyway, if you don't come into the office, which would probably be most ideal, you can call me directly on my cell phone, area code 845-561-2225. Again, 845-561-2225. Please don't text that phone, as that phone does not receive texts, which would defeat the purpose for trying to reach out to me. But if you do like to do the texting thing, you can always text me on my email. My email is docrick, DOCRICK at spineboy.com, docrick at spineboy.com. And whether you stop into the office, call me or email me, whatever way that you get a hold of me, it's my intention to give you the understandings that you need with regards to your health, and I would be happy to help you with your health. This particular class of my weekly video class, healthcare class, is on liver health. Liver, the grand central station of your body. I've been calling it that for 30 years now, and people say, well, why do you call it the grand central station? Well, having lived in New York and still treat people in New York on a monthly basis, Grand Central Station is a very busy hub of people coming into and transferring through Grand Central Station to go to different parts in the city, and it acts like the liver does. Everything in the body that gets into the body eventually finds its way to the liver for inventory and for determining what the body needs, where the components need to go, and what the body can get rid of and excrete. So that's essentially what the liver's main function is to coordinate and control and to plan for maintaining the health of the body. So the liver is very, very important. What are some conditions associated with liver dysfunction? Well, number one condition associated with liver dysfunction happens to be arthritis. Arthritis is a garbage can diagnosis. There's three different main types of arthritis. There's inflammatory, there's metabolic, and then there's degenerative old age arthritis. Those are the types of arthritises that people get simply because they've lived a long time and have a lot of wear and tear and abuse on their body. But whether you have inflammatory arthritis, like a rheumatoid, whether you have metabolic arthritis, like a gout, or whether you have old age arthritis, it's something that all of us are going to develop over time. Now, the liver's main function is to coordinate and control 10 different emotions and coordinate and control the muscles, joints, and tendons. So the liver being in charge of the muscles, joints, and tendons, when you get inflammation in the muscles, joints, and tendons, that indicates a liver imbalance and ultimately results in arthritis. So the 10 emotions associated with the liver are anger, resentment, being pissed off, stubborn, emotional repression or holding your feelings in, depression, indecision, can't seem to make my mind up, irrationality, things just don't make sense, frustration, great emotion that a lot of us have, and aggression, being a little bit too overbearing or forceful in our lives. Those are all 10 emotions that affect the liver negatively and create liver health issues. Another indication of a liver health issue would be your eyesight. If your eyesight continues to get worse as you get older, that indicates too many toxins in your liver. Now, the liver's primary relationship is with the eyes. So the eyes are the windows to the soul, so to speak. It's actually the windows to what's going on with your health. Your ears is about kidneys. Your sense of smell is lungs, large intestine. Your sense of taste which we'll touch on a little bit in a minute, relates to your stomach, spleen, and pancreas. And then your sense of touch is a heart-related emotion. And so focusing specifically on the liver, we've got arthritis, we've got jaundice. That's where you get the yellowing of the whites of your eyes, indicates that the liver is being blocked and not excreting the way that it's supposed to, and you certainly don't want that to happen. Hepatitis. They do commercials on the television for hepatitis for anybody over the age of 55, because they say that you probably have it and you don't even know that you have it, so they want you to come in and do some sort of medical treatment for hepatitis, which ultimately, as we're going to learn in a minute, creates other problems within the body. Elevated or reduced cholesterol levels. We talked in our last video about cholesterol and the importance of maintaining proper cholesterol levels, and the more stress that your liver is under, processing the crap foods, the completely refined and processed foods associated with all the different types of carbohydrates that we're given. When you have too many carbohydrates in your diet, a byproduct of that is going to be to have an increase in your triglycerides. Triglycerides is the conversion form of sugar into fat for storage for future energy. The difficulty is we consume entirely too much completely refined and processed foods. Therefore, we have obesity issues. Obesity is a starvation disease, which is a byproduct of consuming too many foods that don't have good quality nutrition. When you don't have good quality nutrition, your body will hoard the nutrition that you are getting, and it will store it. And the conversion form for storing it is triglycerides. So people who have triglycerides above 100 are consuming too much sugar. People who have a A1A count that's greater than 100, greater than 6, is somebody who consumes too much sugar. So you want to get a sense of how much sugar you're eating. Now, what would be the reason for why people consume too much sugar? Well, primary reason has to do with a condition known as dysbiosis. Dysbiosis is having an imbalance within the digestive system's microbiome, or the good bacteria that help you break down your food. If you have not enough good bacteria as a result of antibiotic consumption, and then you have too much sugar intake, you're going to get an overgrowth of yeast and candida. And the yeast infections and the candidiasis is a very, very common condition that people have, that ultimately, when you can't break your food down properly and you have a lot of gas and bloating within the bowel system, you're going to create micro tears or micro openings within the digestive system wall, and you're going to get a condition called leaky gut syndrome. And that's where whole proteins are not getting broken down fully. They diffuse through the digestive system wall into the bloodstream, and now you have a foreign protein that doesn't belong in the blood. And when you get too many foreign proteins in your blood, your immune system is going to attack those foreign proteins. And you're going to create an allergy response. That's the foundational basis for allergies. But that immune complex that is now circulating around in your blood goes to the liver. And it has to be processed by the liver, and it has to be remedied by the liver. And so when you get a constant influx of toxic byproducts of improper digestion overwhelming the liver, the natural byproduct of that would be arthritis. So that's why so many people have arthritis as they continue to age, is because they continue to have the digestive system imbalance associated with high concentrations of sugar in the diet, medications, primarily antibiotics, which disrupts that bacterial floral balance and leads to the dysbiotic condition that a person has. And so what happens as a result of that? Well, you got the liver stress, which leads to arthritis. You can get indigestion. That's typically a liver indication of having troubles. We mentioned jaundice. We mentioned hepatitis. Difficulty sleeping. People who have trouble falling asleep or wake up between 1 and 3 a.m. in the morning. If you find yourself waking up between 1 and 3 a.m. in the morning, you have liver stress, and would benefit you from having a conversation with me in regards to what's going on with your liver. taking a look at your liver markers, your liver enzymes, your cholesterol levels. We want to make sure that we're addressing that. Now, interesting situation that goes on in our country. If you're a senior citizen, you've probably been asked to take an aspirin a day, maybe a baby aspirin every day, to decrease the likelihood of you having a heart attack. And that's what the medical solution is for people who either have had a heart attack, or if they don't want to have a heart attack, that they should be taking an aspirin every single day. Now, aspirins work in a very specific way to help block inflammation. Now, when a person has arthritis, okay, they're asked to take a non-steroidal anti-inflammatory drug, or what's known as an NSAID, like your ibuprofens or your Tylenols or your Motrins. The difficulty is if you're taking both of those, aspirin to help prevent heart disease and your non-steroidal anti-inflammatories to prevent arthritis, both of those medications have to be processed, just like every medication, has to be processed by your liver. So when you have too much toxins in your liver, you get arthritis. The interesting thing about the non-steroidal anti-inflammatory drugs versus aspirin is they both fight to do the same thing within the liver, but they work differently, and ultimately they end up fighting against each other. Now, why is that a bad situation? Because neither one of them, they're going to cancel out each other's effects. But it's not going to cancel out the functioning that the liver has to perform in an effort to detoxify them of the effects of those two ingredients. And what that ultimately ends up doing is creating more arthritis. So it's fascinating that the solution for arthritis in this country actually creates more arthritis in this country. And people need to wake up to that. Your medication, although it may suppress a symptom, is leading to more problems in your body, and ultimately they have to be processed by your liver. So what are the chances that your liver is toxic? Well, if your eyesight is getting worse while you age, if your arthritis is getting worse while you age, if you have any kind of inflammatory condition at all while you age, if you're taking medications, if you're eating the completely refined crap foods, you're going to overwhelm your liver. And the best solution for that is what we're going to be talking about towards the end of March, which is the doctor-supervised detoxification program. It's a 23-day program, which I'll be getting into in a future video, that actually helps to clean out all your filters. Now, your liver, I don't know if I mentioned this earlier, is one of your 3 internal filters. You have 3 internal and 3 external. Your 3 external filters are your lungs, large intestine, and skin. Those are the external filters that keep things from getting into the body. But if they get through that barrier and they get into the bloodstream, well, now you have things inside the body. Again, we mentioned the allergies. That's an indication of penetration of those external barriers. If it's a contact allergy, if it's a respiratory allergy, or if it's a food allergy, those are all violating the external filters. Then you have the 3 internal filters, the primary one being your liver. You also have your kidneys, which filters all your liquid waste. And then, of course, you have your spleen, which helps you to filter and recycle your blood. So those are your 3 internal filters, and we want to maintain a high level of function in all of your filters. So that's why we will talk about in a future video of the doctor-supervised detox program, and we'll be recommending that to the people through the month of April and May. So, highlights again for the liver. If your cholesterol is high, if you have arthritis, if you take medications, if you have increase in your vision prescriptions as you continue to age, if you have hepatitis, if you have jaundice, if you're difficulty sleeping between 1 and 3 a.m. in the morning, these are all indications of liver issues. I would like to help you with your liver issues. So I'm going to ask you to call me directly at area code 845-561-2225. Email me directly at docrick@spineboy.com, or come into a free healthcare class. Come in for an evaluation. The month of March's special is about offering you an exam and consultation. Normally it's $225. For the month of March, to have your liver evaluated, the cost of that is free. To come in for an evaluation during the month of March, to have your liver evaluated, like I said, the cost is free, but to have your health evaluated, the cost for that is $125. So I would look forward to helping you. I would look forward to meeting you, and I would look forward to helping you remedy whatever health issues that you have that are liver related. Um, that's it for this week's class. I really appreciate your time. Tune back in next week, same health time, same health station. This is Dr. Richard Huntoon from Advanced Alternative Medicine Center, saying I look forward to supporting you when your health matters.